I think it's fantastic for our patients, and we're now really levelling that playing field. And it's a great advantage for our patients now who can actually access the top end of quality of surgery here locally.
Hello and welcome to the RCHT podcast, where this week Royal Cornwall Hospital carried out its first procedure using Cornwall's first ever soft tissue robotic surgical system. And this marked a major milestone for patient care across the county. And Charlie, we were lucky enough, weren't we, to go along to this first surgery?
Yeah, we were, by the divisional chair for surgery, Professor James Clark.
I know, it's awesome. And the surgery was actually following years of planning and fundraising, investment and training. And I spoke to James after the surgery and asked him what this day meant to him.
I think it's a milestone for Cornwall. I think it's fantastic for our patients that finally we're able to offer them the quality of the best that surgery can offer locally, rather than them having to travel so far. So although this is the first case that we've just completed here in Cornwall, I hope it will be the first of many that will provide the outstanding benefits that come alongside robotic surgery for our patients.
Yeah, so tell us a bit about the system then. What have we got here? What are they? What's
so
this?
These are our robotic arms. These are the arms that will hold the instruments, and I will then control these arms from the console, which is remote from the patient. So the system is not an automaton, it's not a robot per se, I control it. It just enables me to control it with much greater precision than I would do manually. The dexterity that the robot offers is far above what a human hand can offer.
What did it feel like today when you were doing that surgery for the first time on a patient here in Cornwall?
I have to say, as a surgeon, it's a very strange experience. From a time when you're intimately related to your patient standing at the bedside to suddenly being removed is a very strange experience for a surgeon of my age. But once you are engulfed in the three-dimensional world that presents you at the console, that all disappears and you're immersed inside. Seeing some of the most amazing visuals of the anatomy internally, the blood vessels, and even sometimes the blood cells being seen within the blood vessels. An incredible visual experience.
It's incredible. And I suppose, and before today, you'd spent a lot of time training on this system with colleagues across Europe, haven't you?
Yeah, indeed. We've been training in Belgium in a world-class robotics training centre. This is called ORSI. We're training on lots of different specimens to really hone our skills. The operation itself is exactly the same. Yeah. It's so the steps are the same. So it's not that we are relearning surgery. It is learning how to use the system to its best potential to give us those greatest advantages. And I have a proctor with me today who's from Switzerland, who's supporting us with our first cases and is giving us guidance on how to do that to maximum benefit of our patients.
And what are you able to do now with this robotic assisted surgery that you couldn't do before?
I think there are, within my field, I think it's really around the vision and the enhanced capabilities that allows us to be safer and promote reduced blood loss. And I think broadly it will enable patients to get home quicker with less complications. But there are procedures in other specialties like urology, which we haven't been able to do, which we now will be able to offer locally, such as a partial nephrectomy or even moving on to prostatectomies in the near future, we hope. So certainly there are cases that we wouldn't have been able to do previously, which we now can.
So you talked about patients being able to get home sooner, but also they're not having to travel as far now that you can do the surgery here, are they?
Absolutely, Pete. So as you know, our patients have had to travel out of county, Plymouth or indeed Bristol, sometimes even further afield, to access this sort of technology. And that's just not equitable really in current times, and we're now really levelling that playing field. And it's a great advantage for our patients now who can actually access the top end of quality of surgery here locally in their home.
So really exciting day for you, and it's only a matter of minutes before you've got your second patient here, isn't it?
Yeah.
So
second case. I didn't think we'd come to that. But
it's fantastic. I'll leave you to it. Thank you so much.
Thanks, Pete.
Sitting alongside James at this first surgery was Pierre, a surgical proctor from a hospital in Switzerland. He's been using this same equipment since September last year, and he was there to support the use of the new surgical robot. And Pete asked Pierre what it's like where he works.
I work in Switzerland, near Geneva and Lausanne. We have the Lake of Léman and the Mont Blanc. It's a beautiful place to go.
That's brilliant. And you've been using this system for how long?
I began in September, and next week we perform the first 100 cases in Switzerland.
Amazing.
Yeah.
And you're here today to support James with surgery?
Yes, it's one of my job. I'm proctoring James, and it's a good pupil. It's a good student. We perform last week hernia, gastric bypass.
All in Orsi?
Yes, in Orsi.
Practicing these cases.
Yes, and I learned tip and tricks. So
teaching me the tips and tricks that allows us to really smooth our whole procedure time.
Yes.
So that's it.
And now that you've reached 100 cases in Switzerland, what difference has this made to you?
More precision.
Yeah.
You have precision for the surgery. We perform normally angio-anastomosis when I make, for example, gastric bypass, but it will be difficult to do. Now it's simple to do. And my assistant, the training, is improved our surgery too.
Pierre, it's been great to meet you. Thank you for joining us here in Cornwall.
Thank you.
Thank you.
Thank you.
So it was really great to kind of see the entire surgical team
it was.
over the moon with this new software. You could just see on James's face for the whole day, he was smiling away.
The level of excitement, he was literally like a kid at Christmas, wasn't he? And I think they've been waiting sort of 7 years or something like that. They've been waiting a long time, haven't they?
Yeah, I mean, it's been a work in progress for about 7 years. But it was only made possible through £2 million worth of NHS England funding, alongside some support from local communities, the Rotary Club, Royal Cornwall Hospital's charity, of course, and some charity fundraisers and campaigners as well, who championed the introduction of the technology. So I guess it's congratulations to the entire surgical team for making this happen.
Yeah, and I mean, from speaking to everyone there, I think it's going to make such a huge difference, isn't it?
It really is, for both them and for our patients as well.
That's it for this podcast. Thank you so much for listening.
If there's an improvement or achievement within your team you'd like to talk about, or a story you'd like to share, please contact us on rcht.communication@nhs.net, as we'd love to hear from you.
And don't forget to subscribe so you can be notified of future episodes.
We are RCHT.